Hello everyone, this is Dr. Jaffrey again. I'm a board certified gerontologist and internist. I would like to address the question about reinfection of COVID-19. So you've had COVID in the past 3 months and now you've retested positive for COVID test. Now this is based on a swab that you had, and if it's after 90 days you have a positive test, or within 90 days with symptoms, you have a high likelihood of a reinfection. Now, there are certain things that the CDC has identified that shown that there's high risk of reinfection rather than recovery related positive testing. So if there's a longer duration, like more than 3 months after the initial infection, there's a high viral load on the PCR, and if you have had antibodies testing in the blood and they were undetectable. So differentiating both of these, reinfection again versus recovery. So those were the main factors, the one that I identified. One, greater than 90 days or within 90 days with symptoms that are just like COVID, like fatigue, cough, and loss of taste. So then what do? Next thing to do is the PCR. There's something called cyclic threshold testing, and this is done in the micro lab. They can, if the cyclic testing level threshold is less than 33, then actually it is likely reinfection. Now, the way to confirm whether this is a reinfection versus just recovery is actually having the genomic sequencing done on the viruses. If the patient's in the hospital, you can check the sequencing of both of the samples, but often this is actually difficult to do. So if it is not the case, then you do contact tracing and see if they are different strains or the same strain. So I know this is a very difficult question, and one thing to remember, especially in the long-term care setting, the patients are coming back positive, and in most of the cases they can have positive test, that is the swab test, nuclear amplification test, up to 3 months. I've had even patients more than that that are coming out positive. So this is a chronic positivity rather than a reinfection. So I've had patients going on surgery who are scheduled for surgery and have COVID test prior and are coming out positive. So, this is likely, still in the recovery process, and they still have COVID positive tests rather than a reinfection. So keeping that in mind.